This is Frequently Asked Questions about Natural Migraine Relief. Episode 25, your response to the latest migraine drugs versus the real root causes of your headaches. Hi, this is Jeff Baker, your physician host for Frequently Asked Questions about Natural Migraine Relief for Women. Today, we are talking about a newer class of drug which has been on the migraine market the last roughly 2 years and how these drugs relate to the root causes of your migraines. You'd have to live a screen-free life to miss hearing ads for brand names like Aimovig, Ajovy, Emgality, Vyepti, Ubrelvy, Nurtec, Qualipta, or Zazpret. My personal theory is that they got these names from a list of Aztec or Klingon warlords. What these medications do have in common is that they minimize and modify the brain response to a molecule called CGRP, or calcitonin gene-related peptide. The first four of the drugs I listed above use monoclonal antibodies, which target either CGRP or the CGRP receptor. The second four listed are gebants, which are small molecules that can block the CGRP receptor. Both groups are used for either acute therapy or prevention, and they are truly a breakthrough in pharmaceutical therapy for migraine. The CGRP molecule is one of the most potent vasodilators in the body. It is released when the brain needs more oxygen and nutrients to manage acute or chronic stress and injury. The process of CGRP release also results in elevated amounts of pro-inflammatory neurochemicals, local tissue edema, and an enhanced sensitivity of nerves to pain. In this situation, a migraine headache is to a degree the price for repairing the brain strain, stress, and inflammatory damage from what are often unidentified root cause factors. We should keep in mind that an elevated CGRP is not the root cause of a headache. It is the body's reaction to one or more underlying causes. Always remember that symptoms or their resulting chemical pathways are not the disease. They are the body's response to underlying functional imbalances as its attempt to reestablish balance and to restore normal function and health. So let's consider two versions of response to CGRP blocking drugs. The first would be the roughly 40 to 50% of migraine patients who will get at least 50% pain relief from the CGRP medication group. As I look at it, pain relief equals no pain. So is this not a good thing? Yes, absolutely, said anyone who ever had a migraine ever. But it does explain and manage the reasons that the brain thought that it needed the CGRP-induced vasodilation for self-therapy. It does not. It's somewhat like pasting a dab of duct tape over the check engine light. Short-term engine-related anxiety may be allayed, but ignoring this signal can have significant future consequences. We may be able to block the CGRP-related pain, but we are also, to a degree, blocking the role of CGRP in the cycle of repair. This process of migraine pain management teaches us nothing new about the under-the-surface root cause factors that are pushing the CGRP's buttons. Ignoring them by making the pain just go away may allow for an underlying and recurrent vicious cycle that can perpetuate the migraine process for many patients. The second version would be the other 50 to 60% of patients who did not respond meaningful to CGRP drug therapy, which would include the 50% or so from the first group that were only partial responders. For this group, CGRP blockade alone may not be enough to reduce the migraine pain cycle. For some of these patients, meds like the CGRP blocking drug could be a useful adjunct if we could also reduce or clear some of the underlying root cause factors that are driving brain stress or damage, causing the brain to push the CGRP to the rescue button. So what are the true root cause factors driving your migraines? If you've been reading my FAQ episodes, you can see that many topics address some of the expressions of the most common underlying root causes promoting migraines, including the CGRP pathway, including 1, multiple sources of brain inflammation and adverse immune activation, 2, reduced cell energy production, 3, nutrient deficits that affect cell repair and function, 4, hormone imbalances, which can include your reproductive hormone levels and ratios through all 4 hormonal phases of life: premenopause, perimenopause, menopause, and postmenopause. They further include 5, thyroid and parathyroid hormone imbalances, 6, adrenal dysfunction and pineal gland deficits, 7, brain chemistry imbalances, 8, alteration of autonomic nervous system function, 9, lifestyle habits, and 10, structural anatomical factors. The process of understanding your own profile can feel overwhelming, as there are so many potential contributing factors, and the combination in play for any one person with migraine is unique to their story. Reviewing this blog's previous FAQ episodes that address root cause factors can provide clues that may apply to your situation. Past FAQ episodes 3, 9, 13, 16, 20, 22, and 24 would be a good place to start. Episode 21 talks specifically about the use of ginger, which also reduces CGRP levels as a frontline migraine therapy. Taking this could also help patients who are already taking CGRP blockers to get a better response from their medication. You can also learn much more about your specific migraine root cause factors by looking to naturalmigrainerelief.online for my online course on how to find and personally triage the best non-drug therapies to proactively manage your migraine headaches. Please remember to like this video to get my regular postings on FAQs about natural migraine relief for women.